Okay, so today we're going to discuss all about the fibrinolysis. So fibrinolysis is simply your clot dissolution. So this is the last phase of the normal clotting process when the patient try to have here wound or a tissue injury. So that would result in the clotting process. But eventually, if you have already the clot in the blood has been stabilized by our factor 13, so the next thing you're going to do here is to dissolve the clot because normally we don't have the clot within our blood vessels. Okay, so dapat wala nakabara doon. So again, as a review, so when speak about your clot formation, so we have your fibrinogen. It's being acted by our thrombin that will be converted here to your fibrin clot. And after that one, to have here a stabilized na clot, okay, this occur here if you have a tissue injury. And after that, your fibrin clot should be stabilized by factor 13 in order for that to stop the bleeding process. To make that one more effective in the having a stable na clot natin. But then again, we should not stop on that only here. So after you have already formed here a stable na clot, stabilized by factor 13, the next thing you're going to do here is to digest our clot here. The entire process called here your fibrinolysis. So what digests our clot here would eventually be the plasmin. Okay, so your fibrin clot should eventually be acted upon by the plasmin, converting that one to our fibrin degradation products. In order for you to dissolve the clots within our blood vessels, because normally dapat wala tayong clot dito. Nagkaroon lang tayo ng clot because again, you have a tissue injury. But then again, you should also remove that one. So your fibrin degradation products na mapaform here with the dissolution of your clot includes your X fragment, your Y fragment, and we have also your D dimer. Okay, but then again, your plasmin, so since this is responsible here for the clot dissolution, your plasmin is being produced here by our liver primarily in inactive form. So inactive form, the form of your plasminogen. Okay, so you need to convert this one to the active form, the plasmin, before it can act on our fibrin clot to convert that one to your fibrin degradation products. So in order for you to convert your plasminogen to your plasmin, the active na proteolytic enzyme, you need to activate first. So our activators for that includes your TPE, tissue plasminogen activator, UPase, your urokinase plasminogen activator. You could also have your streptokinase. On the other hand, to prevent here too much, for example, kung ang mangyari nito, kung too much dissolve ka ng clot, okay, so that one, too much activation of this one results here to the bleeding manifestation. Pag wala ka naman ito, again, pag sobrang dami ng activators natin, that results to your bleeding manifestation. But in the absence of your activators, ano mangyari pag walang activators? Your plasminogen will not be converted to your plasmin and therefore walang magda-digest ng clot natin. And therefore, pag walang mag-digest, what you have here would be your thrombus formation. Again, pag madami ito, this results to your bleeding. Okay, pag wala ka naman ng mga activators natin, that results to your thrombus. Okay, thrombus formation. Then we have also here the inhibitors. Okay, inhibitors here includes your pi1 plasminogen activation plasminogen activation inhibitor 1, alpha 2 antiplasmin, and we have also your thrombin activatable fibrinolytic inhibitor, fibrinolysis inhibitor. We're going to discuss each of this one. So our topic today will be discussing here about the different action of the activators and also your inhibitors in helping and preventing also here our clot dissolution. Okay, so again, we have here your plasminogen. So your fibrinolysis again that try to occur here a few hours after your stabilization of your clot, and that one is being done here by our plasmin. Okay, so again, as what we have discussed, so your plasminogen, in order for that to be converted to your plasmin para ma-dissolve ang clot natin, so you need here the activators. Okay, then we have here the plasminogen. So plasminogen is produced primarily by our liver. And this one contains here 5 glycosylated loops, or called as well kringles. The 5 glycosylated loops here, or the kringles, serve as its binding site para makapag-bind sa ating fibrin clot. So for example, kung ito ang fibrin clot natin, ito ang plasminogen natin. Your plasminogen contains these kringles. Okay, dito naman, ang makikita is your lysine residue. Okay, so again, basically, your plasminogen, ang kanyang binding site to your, this is your clot, ha? Okay, so ang binding site ni plasminogen natin para makapag-bind sa clot natin is its kringles or glycosylated loops. Dito naman sa clot natin, ang nagiging binding site niya ay kanyang lysine residue. Okay, so ulit, ito ay makapag-bind sa ating clot para ma-dissolve niya by the kringles, and this one would have here the lysine residue in order for that then to allow the binding of your plasminogen. Okay, then we have here the plasmin. So the plasmin is the active form of your plasminogen. This one is the serine protease. We try to hydrolyze. Kung sinabi serine protease, this one is a proteolytic enzyme. We try to hydrolyze our fibrin clot. Okay, so it try to hydrolyze your fibrin clot. This one is your fibrin clot by these lysine residues. So ito ang tinatanggal niya, lysine residues. Pag tinanggal niya ito, mag-expose ulit ng lysine residue. So magbabind ulit sa plasminogen. And further, allowing this one, okay, so lysine residue, ang plasmin natin, tinatanggal niya si lysine, it try to hydrolyze your lysine residue. So pag natanggal si lysine residue, mag-expose ulit siya ng lysine residue. Okay, then magbabind ulit sa plasminogen until all your clot has been degraded. At ito magiging product mo. X fragment, Y fragment, D dimer. Okay, your free plasmin, on the other hand, can also bind with your factor 5, aside from your fibrinogen. It could also bind with your factor 5, factor 8, fibronectin, and even your fibrinogen. I need to add. Okay, try to bind with your fibrinogen, factor 5, factor 8, and fibronectin. So, pag free ang ating plasmin, could bind on those substances and try to digest those substances. Okay, now we have here the activators of your plasminogen. Again, the activators of the plasminogen, they are the one responsible here for converting your plasminogen to your plasmin, which is the active na proteolytic enzyme natin that will digest your fibrin clot natin. Okay, so increase sa activators. So pag madami kang activators, much of your plasminogen will be converted to your plasmin, and therefore digestion ng digest. This result here to your bleeding manifestation. But in the absence of your activators, plasminogen will not be converted to your plasmin, and therefore your clot will not be dissolved. And therefore what you have here would be your thrombus formation pag wala kang activators. So our activators here may be in the form of your contact factors, factor 12A, prekallikrein, high molecular weight kininogen. And you could also have your tissue plasminogen activators, your kinase, your TPA. Also, we have also your streptokinase. So we have here the main activators. So first, we have the TPA or your tissue plasminogen activator. Your tissue plasminogen activator is basically produced here by our endothelial cell. And that one would have two glycosylated loops. So, ang glycosylated loops nito, again, this one would tend to bind with your plasminogen para ma-activate ang ating plasminogen para ma-convert siya into your plasmin. Okay, another one, we have here your UPA or your urokinase plasminogen activator. So, this one is being produced by our renal epithelial cells, kaya nga sinabing uro. Uro meaning to say kidney. This one is also being produced here by your monocytes, macrophages. Okay, so this also eventually tend to convert or try to activate our plasminogen and converting that one to your plasmin. Another activator, we have your streptokinase. Okay, this is an activator primarily produced by your beta hemolytic strep. Okay, so mga strep natin na produce ng streptokinase could also activate converting your plasminogen to your plasmin. Okay, now we go to the inhibitors of your plasminogen. Okay, in the presence of high concentration of the inhibitors, pag madami kang inhibitors, that results to your thrombus formation. Why? Because pag madami kang inhibitors, much of your plasminogen will not be converted to your plasmin. Okay, so pag madami kang inhibitor, pag madami kang inhibitor, plasminogen natin will not be converted to your plasmin. Pag hindi siya ma-convert, and eventually walang magda-digest, di ba? So therefore, that's the results to your thrombus formation. Pag wala ka namang inhibitors, ano mangyayari? So much of your plasminogen will be converted to your plasmin kasi wala naman nag-inhibit. And therefore, that results to your bleeding manifestation. Okay, we have here the different inhibitors. So we have your alpha-2 antiplasmin, alpha-2 macroglobulin. We have also the pi-1, and you could also have your TAFI. So we'll be discussing much of the pinaka-main inhibitor natin. The first one, we have the pi-1 plasminogen activator inhibitor 1. So again, from the words of plasminogen activator inhibitor, they tend to inhibit your plasminogen activators. Ano ulit ang plasminogen activators natin? TPA, UPA. So yun ang action ni pi-1 natin. Your pi-1 is being produced here by your endothelial cells, megakaryocyte, smooth muscle cells, fibroblasts, adipocytes, keratinocyte, hepatocytes. And this was being stored as a component of the alpha granules of our platelets. Again, anong pinaka-main activity nito? It try to inhibit our plasminogen activators. Ano ulit ang activators natin? PPA, okay, UPA. So that's the main activity of your pi-1 which try to inhibit your TPA saka UPA. Okay, and therefore, pag wala kang TPA and the UPA, your plasminogen will not be converted to your plasmin. And therefore, so plasminogen ka lang, wala kang plasmin. Okay, wala kang plasmin for that is because your pi-1 tend to digest, neutralize the activity of the UPA and your TPA. And therefore, plasminogen ka lang, hindi siya magiging plasmin in the presence of your pi-1. Okay, the next inhibitor here of our plasminogen, we have your alpha-2 antiplasmin. So basically, this one is directed with your plasmin itself. Okay, so we have here the activity of your alpha-2 antiplasmin. Number one, it try to compete with the lysine residues of your plasminogen. Okay, and therefore, plasminogen will not be converted to your plasmin because of that. Another one is it could also binds and inactivates our plasmin. Dito, plasminogen ka pa lang, wala kang plasmin. Dito, may plasmin ka na. Only that, your plasmin, pag meron ka ng plasmin, it tend to digest. Tend to neutralize your plasmin. That's the action of your alpha-2 antiplasmin. Your pi-1, kanina, so ang activity ng pi-1 natin with your activators. And therefore, wala kang plasmin talaga maproproduce because your plasminogen is never converted to your plasmin. Alpha-2 antiplasmin, okay, so pwede siyang plasminogen, hindi siya ma-convert to your plasmin because it tend to compete with the lysine residue as its binding site to your fibrin clot. Or the second one, you have already your plasminogen converted to your plasmin. But if you have your plasmin already, ang ginagawa niya, it tend to inactivate that one. So therefore, in the case of your alpha-2 antiplasmin, you have already, you might have or might not have your plasmin. Sa pi-1, never ka nagkakaroon ng plasmin kasi plasminogen pa lang siya. Hindi siya makakonvert to your plasmin. But the alpha-2 antiplasmin, it could be, so kung ito siya, competing sa wala kang plasmin. Because your plasminogen will not be converted to your plasmin. Second one, your plasminogen has already been converted to your plasmin. Okay, third one, TAFI, thrombin activatable fibrinolytic inhibitor. This one is being produced here by thrombin thrombomodulin activation. Okay, this one is also synthesized by our liver. And basically, its main action, it tends to hydrolyze your lysine residue. So remember that the lysine residue is the binding site of your plasminogen. So pag wala ka, for example, ito yung clot natin ulit. Okay, this is your lysine. Okay, ito yung plasminogen natin. Okay, magbabind ito sa lysine residue. Ang ginagawa ni Taffy, so tatanggalin niya ito, and therefore, ang plasminogen natin, hindi makabind sa fibrin clot natin. And eventually, pag hindi siya nakabind, your plasminogen will never be converted to your plasmin. Okay, so ganun din with your pi1, it will also prevent the conversion of your plasminogen to your plasmin. Okay. Okay, now we have here the disorders of your fibrinolysis. So, again, for the Taffy, never ka, hindi siya magbabind. Never siya magbabind sa ating fibrin clot because it tend to hydrolyze here the lysine residue. Okay, then we have here disorders of your fibrinolysis. So, the primary fibrinolysis is characterized here by the excessive activation of your activators because we are producing here malignant cells which are producing much of your activators. So, in the case, for example, your prostate cancer. Okay, so in the primary fibrinolysis, wala tayong fibrin monomer, fibrin polymer, and even your D-dimer. Secondary fibrinolysis, on the other hand, is associated with our DIC, disseminated intravascular coagulopathy. And this one characterized here by the inappropriate formation of your fibrin clot that might be related to your snake bite infection, infectious snake bite, or even your neoplasm. This one differ with your primary fibrinolysis because what you have is already here, fibrin monomer, polymer, and D-dimer. So meron tayo nito. Compare this one, wala tayong fibrin monomer, polymer, wala din tayong D-dimer na puproduce. Okay, then we have also here the fibrin degradation products in your D-dimer. So we have here the X fragment. The X fragment represent here actually the original structure of our fibrinogen. Remember that your fibrinogen is itong structure niya, di ba? D-dimer. We have your D-domain. Meron siyang terminal D, dalawang D-domain on a terminal end. Tapos sa gitna niya may E-domain. Okay, that's your X fragment. Your Y fragment, pag tinanggal ang isang D, pag tinanggal na siya by hydrolyzing that one, it become your Y fragment. So, pag ito, on the other hand, ang D-dimer natin represent here dalawang D na nag-attach to one another, cross-link here by the factor 13, which represent dalawang terminal D domain. So, ito, for example, ito isang fibrinogen structure, another one, parang ganito siya. Di ba ganyan? Okay, so this is one fibrinogen, one fibrinogen. Okay, so ang dalawa na to, pag nag-attach sila, cross-link by factor 13, pag tinanggal mo silang ganyan, dalawang D lang, that become your D-dimer. Okay, then we have here the test for our fibrinolysis. So first, we have here the whole blood clot lysis time. So for the whole blood clot lysis, just have the whole blood and then try to measure lang, monitor kung kailan siya magkakaroon ng clot lysis. Mag-lyse ang clot natin. Normal, so dapat after 24 hours, doon pa lang siya magka-clot. Pag-lyse ang clot natin. But in the case of your abnormality na fibrinolysis, hindi pa siya 24 hours, nag-digest or nag-lyse na agad ang clot natin. That's abnormal. Another one, we have your uroglobulin clot lysis time. So, your uroglobulin actually represents here the portion of the plasma containing here the fibrinogen, plasminogen activators. So, you wanted to measure here kung kailan siya magla-lyse ang uroglobulin natin. So, first one, you need to precipitate your uroglobulin by addition of your acetic acid. So, pag nag-precipitate mo na, nakuha mo na ang ating uroglobulin, you dissolve that one in a buffer. Then, para mag-digest siya, lalagyan mo ng thrombin. And try to monitor kung kailan siya magla-lyse. So, normal dapat, lysis here occurring more than 2 hours. Pag ang lysis natin occurring here less than 2 hours, so we consider that one as our abnormal. Another one, we have your protamine sulfate. So, this test will identify the presence of your primary fibrin the presence of your fibrin monomer. Okay, so procedure for that, we have the plasma. Then you add your protamine sulfate, then observe here for the precipitation. So pag nag-positive, it will identify the presence of your fibrin monomer. Ethanol gelation test also for identification of your fibrin monomer. Procedure for that plasma, you add NaOH plus your ethanol. Okay, positive reaction also precipitation. Positive result will identify the presence of your fibrin monomer. Okay, then we have also here the test for the D-dimer. Again, the D-dimer is basically the fragment that is very specific for the DIC. So if you get positive result for the D-dimer, then that's associated with your DIC. We have here the test for the D-dimer. We have your enzyme immunoassay. This is your immunoassay, not the enzyme, immunoassay. Since immunoassay ito, so gumagamit tayo ng antigen-antibody complex reaction. So D-dimer as your antigen. Okay, as your sample here, so for detection of that one, gagamit ka ng the anti-D-dimer antibody. Okay, so your agent is in the form of your micro-latex particle coated with anti-D-dimer antibody. So positive results, turbidity, or even the light scattering with your nephelometry. So the more turbid your sample here, the more lights being scattered, the higher the concentration of our D-dimer. Okay, so we have here the difference between your primary fibrinolysis versus your secondary fibrinolysis. Remember that our primary fibrinolysis, wala tayong fibrin monomer, polymer, and the D-dimer, which are all found only in your secondary fibrinolysis. So whole blood clot lysis here, so both of that will have less than 48 hours because again, these are abnormal na fibrinolysis. Your globulin clot lysis, both of them would have here less than 2 hours na clot lysis. Protamine sulfate will identify the presence of fibrin monomer. So, dito lang siya sa ating secondary fibrinolysis. Globulin clot lysis also would identify, ethanol gelation test, will identify the presence of your fibrin monomer that will only be giving positive result only here with your secondary fibrinolysis. And your D-dimer, again, is only specific for the secondary fibrinolysis but not in the primary fibrinolysis. So, positive here and negative for that one. Okay, then we have also here the fibrin degradation products as what we have discussed, the X fragment, the Y fragment, and the D-dimer. The fibrin degradation products represent here the original structure, the fibrinogen. Again, that's your, for the X fragment, that's your D, E, D. For the Y fragment, it's only D and E, wala kang D. Try to remove the 1D. And again, your D-dimer represent here the 2 terminal D domain, which has been cross-linked by the factor 13. So normal values here for the fibrin degradation products is less than 2 nanogram per ml. But if you have here more than 200 nanogram per ml, that would signify related to your DIC, systemic fibrinolysis, deep vein thrombosis, and we have also here your pulmonary embolism. Okay, we have here the test also for your fibrin degradation products, so you can also identify them by your immunoassay. So this is your semi-quantitative nga lang agglutination test, which is also your immunoassay. So like for example, if you wanted to detect your fragment E, so kung fragment E ang gusto mo detect, so that's your polystyrene latex particles, your agent coated with your monoclonal anti-E antibody. But if you are detecting for the fragment D, so ang ating reagent would be your polystyrene latex particle plus coated with your monoclonal anti-D antibody since we're detecting for the D antigen. Positive result for this one is agglutination reaction. Okay, we have here the test. You call this one as your chromogenic substrate assay. Chromogenic substrate assay. So from the word sub uses here, chromogenic substrate. Pero sabing chromogenic, colored. So magkakaroon ng color reaction ng ating substrate. Usually this test uses here your chromogenic substrate in the form of your p-nitroanilide. That one is colorless, but upon activation, it will be converted to become yellow na color. So example for that, before we go with that, so we have the term fibrinolysis deficiency. Deficiency in the fibrinolysis would mean here that you have a decreased concentration ng ating mga activators. But what you have here is a high concentration ng inhibitors like your pi1, and that's would result here to the thrombus formation. Okay, so we could also measure the concentration of your plasminogen. Okay, so we have your plasminogen chromogenic substrate assay. So for that, ito ang measure natin ng concentration. So here, para ma-measure natin ang plasminogen, you need to activate that one. But with that, you are using the streptokinase as your activator. Streptokinase, again, this one is being produced by your beta hemolytic strep, converting that one to your plasmin. Once you have your plasmin, so your chromogenic substrate na p-nitroanilide will be converted to your colored na p-nitroaniline. Okay, that was you are measuring here by your spectrophotometry or even by fluorometry. It's more the spectrophotometry. Okay, the result here, so this one, intensity of the yellow na color will be directly proportional to the concentration of plasminogen. Mean to say, the more intense the yellow color, the higher the concentration of your plasminogen for this one. Okay, now we go to your activators. Again, our activators, plasminogen, includes your TPA and the UPA. Again, TPA is being produced by the endothelial cells with a half-life of 3 minutes. Normal concentration for that in our plasma is 5 nanogram per ml. And we have the UPA is being produced by our kidneys and your vascular cells, including your monocytes and macrophages. Half-life for that is 7 minutes. And a normal values for that is 2 to 4 nanogram per ml. So most likely between the two, ang usually na mini-measure natin na or available na test for the measurement of your activators would be the TPA. So this one is also TPA chromogenic substrate assay din siya. It's a chromogenic substrate assay. Okay, but we have here some guidelines consideration when you are collecting the specimen for your TPA assay. Number one, okay, this one is increase in exercise, the urinal variation, so increased level in the morning. You need to say you collect the specimen in the morning. Patient should be at rest, dapat hindi siya stress. Okay, they should have your minimal tourniquet application. And you need to immediately acidify your sample by addition of your acetate buffer para ma-preserve ang ating TPA. Okay, again, the TPA measurement here is also a chromogenic substrate assay. So again, plasminogen, so itong may measure natin ang concentration. Okay, so it will be converting that one to your plasmin by the action of your TPA. That's what you are measuring. If you have already your plasmin, the plasmin try to hydrolyze your chromogenic substrate, the PNA, which is colorless, converting that one to your colored na p-nitroaniline, which is a yellow na color. Again, the intensity of the yellow color here would be directly proportional to the concentration of your TP. The more intense, the higher the concentration. Okay, the specimen utilized here for the TPA assay would be the PPP or the platelet-poor plasma. And however here, if you're not able to utilize or process the specimen immediately, you need to frozen that one at negative 70 degrees Celsius here in order for that not to be deteriorated. Okay, now we have here the Pi1 assay, which is your inhibitor for our activation of your plasminogen. Okay, the Pi1 is being produced by the different cells in our body, including your endothelial cells, and even it's being stored as a component of the alpha granules of our platelets. So the specimen collection, same guidelines as with the TPA assay. We are using also platelet-poor plasma on that. Okay, and for this one, you just need to centrifuge your blood immediately and try to separate the plasma immediately to prevent the in vitro release of your Pi1 of your platelets. Because remember that your platelets, the alpha granules of that stored near your Pi1. So pag nag-collect ka ng specimen, put that one in your citrate na tube, you need to separate the plasma immediately in order to prevent here the in vitro lysis of your platelets to release here the Pi1. Okay, we have here the different method for the Pi1 assay. The first one, we have your enzyme immunoassay. For the enzyme immunoassay, try to utilize your urokinase. Okay, combining with the Pi1 to form your Pi1 urokinase complex. Then you add your monoclonal anti-Pi1 antibody. And try to measure here the monoclonal anti-urokinase immunoglobulin complex. So the higher the concentration this one, the higher the concentration of your Pi1 is directly proportional. Another method here for the Pi1 assay, we have here your chromogenic substrate assay. In the chromogenic substrate assay, gumagamit siya ng activator na TPA. Pero sa enzyme immunoassay, ginagamit yung activator would be your urokinase. Okay, or the UPA, urokinase UPA. But in the chromogenic substrate assay, ang kanyang activator na ginagamit is your TPA. Okay, so the reaction, TPA plus your pi1, so again, still gumagamit pa rin siya ng platelet for plasma. Plasma pa rin ang ating sample. Okay, we have your TPA plus your pi1 to form TPA pi1 complex. Then we have your residual na TPA. Okay, so it would highly dependent on kung gaano kadami ang pi1 natin. So pag wala kang residual na TPA, meaning to say sobrang dami ng pi1. Okay, pag sobrang dami ng residual na TPA, wala kang pi1. Ganon yung principle nito. Ulit, pag sobrang dami ng residual TPA, okay, meaning to say, wala kang pi1. Mababang level ng pi1. Pero pag wala ka masyadong residual TPA, madami kang pi1, kaya madami siya nagbabind dito sa TPA natin. And therefore, wala kang residual, wala kang kulang, ganon. Okay, so if the residual TPA produced here is being left, it eventually will be the one going to hydrolyze your plasminogen, converting that one to your plasmin. Then the plasmin combining with your chromogenic substrate, your p-nitroanilide, which is colorless, will be converted to your yellow. But this one would have inversely proportional kasi nga sinabi ko, pag madami kang residual na TPA, mababa ang level ng ating pi1. So therefore, pag madami kang intensity or sobrang yellow nito, mean to say madami kang residual na TPA, and mean to say wala kang decrease ang ating pi1. Pag wala ka masyadong, for example here, pag wala ka masyadong residual TPA, so konti din ang intensity nito, hindi siya ganun ka-yellow na color, signifying na sobrang dami ng pi1 natin. Since marami kang pi1, wala kang sobra. Ganun. Wala kang sobra na nagbabind, katulad nito. Pag madami kang pi1, for example, ganyan. Okay, so pag madami kang pi1, so madaming magbabind dito sa TPA natin, so wala kang residual. Okay, so for example, kung wala kang pi1, konti ang pi1, magbabind sa TPA, so sobrang dami ka ng TPA na sobra. It's because wala kang pi1. So madami mag-sobrang TPA natin. And therefore, pag madami kang sobrang residual na TPA, it would mean na wala kang pi1. That's why this one would have inversely proportional ang kanyang result. Okay, to confirm this one, so instead of the plasma, gagamit tayo ng serum as our sample for that because your pi1 most likely ay madami siya sa serum na patient. So, pag kumuha ka ng blood, serum ang sample mo dito, pag mababang level ng pi1 sa serum, so it will signify that the patient would have the pi1 deficiency. Okay, so thank you.